Hello! In this video, I will try to provide answers to frequently asked questions about UROREC capsules. If the video is helpful to you, don't forget to like it and subscribe to the channel to support me. What is UROREC, and what is it used for? UROREC is a medication that contains the active ingredient Silodosin. It is available in capsules in doses of 4 mg and 8 mg. UROREC is a medication used in the treatment of benign prostatic hyperplasia. It's prescribed to alleviate urinary problems resulting from prostate enlargement and can also help reduce the size of the prostate gland to improve symptoms. How is UROREC taken? The recommended dose is 1 8 mg capsule once a day. For men with moderate kidney problems, the starting dose should be 4 mg once a day. This may be increased to 8 mg once a day after a week. UROREC is not recommended for patients with severe kidney problems. The capsules should be taken with food, preferably at the same time every day. They should be swallowed whole, preferably with a glass of water. When can I expect to see the effects of UROREC? The effects of UROREC can vary from person to person. Improvement in symptoms typically begins within a few weeks, but it may take several months to see the full effect. Who is UROREC recommended for, and who should avoid it? UROREC is recommended for men with BPH symptoms. However, it may not be suitable for everyone due to potential interactions with certain health conditions or medications. Your doctor should determine the most appropriate treatment for you. UROREC should not be used in people who may be hypersensitive to Silodosin or any of the other ingredients. What precautions should I take when using UROREC? When using UROREC, it's important to limit alcohol consumption, avoid excessive fluid intake, and follow the dosage recommended by your doctor. Additionally, inform your doctor about any other medications you are taking and your overall health condition. What are the side effects of UROREC? The most common side effect with UROREC is the reduction in the amount of semen released during ejaculation. Side effects of UROREC may include headaches, dizziness, nausea, and changes in sexual function. If this video has been helpful for you, please like the video and subscribe to the channel. Feel free to share your thoughts and experiences related to medication use in the video's comment section. Wishing you all a healthy day.